Hi, my name is Kirsten Raymond, and I'm a student at the University of St. Augustine for occupational therapy. Today I would like to present to you guys evidence to support the use of a moist hot pack to reduce pain levels in the geriatric population. The title of this article was Thermal Changes in Pain and Sensory Threshold of Geriatric Patients After Moist Heat Treatment. The following are the listed authors of this study. It was published in the year 2011, and the country it was published in was Korea. This article presents level 3 evidence using a pre-post test design. This article did not have a control group, and it did have a small subject population, so it limited the evidence. The focus question for this article was, how does a moist hot pack application to the low back, shoulder, or knee of a geriatric patient affect temporal changes in sensory threshold and pain? So basically the question that the article was focused on was seeing how the use of a moist hot pack affects the pain levels of a patient in certain joints, as well as the sensory threshold. And we'll get into more of that a little bit later. The total number of subjects in this study was 74. There was 45 female and 29 male, with the average age of 72.6 years. Interestingly enough, the average height of these subjects was 5 feet 2 inches, and the average weight was 130 pounds, which is something we should consider when we realize that when we talk about joint pain in the geriatric population, it could be due to poor posture, or it could be due to overweight, just too much stress on the joints. And to know that, we can assume that this might not have come into play. Unfortunately, the study failed to include an inclusion-exclusion criteria in their article, which also limits the evidence, because when we talk about joint pain, it can stem from any sort of issue. It can be an overuse issue, or an injury previously. It could be an injury from when they were in their 20s to last week. So we really don't know what injuries are associated with these joint pain, so we don't know the effectiveness of, or even the contraindications that they use when using.
Hi, my name is Kirsten Raymond, and I'm a student at the University of St. Augustine.
The intervention used was the application of a 25 by 30 centimeter moist hot pack for 30 minutes to either the low back, shoulder, or knee in the geriatric population. The hot pack was heated for at least 24 hours was Thermal Changes in Pain and Sensory Threshold of Geriatric Patients. Before the intervention, they did a few tests, and then they did tests at different increments afterwards. It was published in the year 2011, when they did apply was published in Korea. They used anywhere from 2 to 3 layers of toweling. Article presents level 3 evidence. The patients were told pre-post test design. Keep it at a article did not have control group, if it became uncomfortable, and it did have a small subject population. So the outcome measures used in the study were the visual focus question scale, for this article, the FACES pain rating scale, Iowa pain thermometer, and the sensory threshold, shoulder or knee of a geriatric patient. So they used 3 different pain scales to kind of find a uniformity. So basically, the question that just to get a better sense of focused on was seeing how the use of a and the use of sensory threshold. They wanted to see how the modality pain levels of a patient and their ability to modulate pain in the sensory threshold. And we'll get into more of that. So their theory was that if they did, then total number of subjects in this study was 74. There was 45 female and 29 male, so that they with the average age of 72.6 years. Interestingly enough, the average height of these subjects was 5 feet 2 inches, and the average weight was 130 pounds. Which is something we should consider measured prior to the use of the modality. Joint pain geriatric population. Right after the use of modality, 1 hour after the use of modality. And then the pain scales overweight, just too much stress on the joints. Monitor to know that 3 hours, 6 hours. We can assume that and then this 12 hours afterwards, and then the next day the study failed to include. So they did test the pain throughout the day in their article. The statistical test also limits the evidence. Analyze the results for the pain test, and stem from any sort of issue. Can be an overuse. And when they did analyze the results, they found or an injury. Very significant findings. There was a significant decrease in pain for all 3 joints right after the application of what injuries are associated with these joint pain. So once they are moved, we don't know the moist hot pack of after 30 minutes. Even the contraindications that patients reported when using significant decrease in pain. And this significant decrease maintained. The intervention used up to about 6 hours. The application of a 25 by 30 centimeter moist hot pack for 30 minutes to either the low back, shoulder, increase right after the use of the hot pack was heated for at least 24 hours. That did not mean to use the hour afterwards or the next day. Before the intervention, what this basically is saying is the use of the moist hot pack can be used in different increments afterwards to address pain.
When they did
apply the hot pack, they used anywhere from 2 to 3 layers of toweling function. And then right afterwards, you would see the results. You could do more keep it at the strength of the study was that they used a variety of pain scales.
Would add more layers.
Meaning they used 3 different ones, so they didn't just
the outcome measures
used in the study were the visual analog scale,
and they did not compare this hot
scale,
Iowa
pain thermometer, and
other studies using the moist
electrical
stimulation.
Did compare it to the use of
either
they used different pain
modalities
scales
or
to
just
other
forms of
modalities
of
kind of
just
to get a better sense of what their pain rating is.
And this study was one of the
and
first
ones to
sensory
test
threshold
because they wanted to see how the modality affected
their ability
to modulate pain.
Unfortunately, there is a lot of limitations.
The study failed to report a variety of information, such as inclusion or exclusion criteria, location of the study, duration of the study, recruitment of subjects, or information about the subject's medical history.
Like we touched on before,
neurons in that area.
Any of these things can skew the results.
They did not mention how they recruited these patients, if they were just patients.
These outcome measures were measured prior to the use of the modality.
They didn't say the time frame
right after
they
used the modality,
1 hour after the use of the modality, or
the pain scales were
anything like that, and that can all affect
monitored
the results.
3 hours, 6 hours.
They did have a small sample size,
12 hours
afterwards,
and then the next
there
day
was no
they were
control group to compare it to. So they did test the pain throughout
there was
the day.
no functional outcome.
So for OT, that's really important because analyze the results for the T-test, they saw that the pain did decrease afterwards.
And when they did analyze the results,
they found
increased functional
very significant findings.
There was a significant decrease in pain
for all 3 joints
right after the application of
different
occupational
moist hot pack. So once they removed
the last thing that was an issue was
they had an uneven number of subjects for
patients reported.
So the majority of
significant
decrease
in
low back
pain,
and
which
significant sensory neurons
maintained
the different number of sensory
up to about
neurons
6
in the
hours
area compared to maybe the knee or the shoulder.
After about 6 hours,
low
so
back
pain
pain
tends
to be more of like a
and there was
injury
a significant increase
right after the use
injuries.
of the hot pack.
It's just a different type
the
of
sensory
injury
threshold. However, that did not maintain
react
the hour
afterwards
or the next day. So
like I said earlier, the clinical
what this
implications
basically is saying is the
clinicians can use a
moist hot pack to the shoulder, lower back, or knee
prior to occupation
address pain,
to reduce
acute pain or
the geriatric population.
Just
pain
using this modality.
We're able
and then right afterwards, you'd see the results.
So you could do
the
more
pain
right
levels
afterwards.
Possibly
the strength of the study
was that they used a variety of pain scales.
However,
meaning they used 3 different ones, so they
didn't
just rely on one. They could just get a better
so
feel
we
for
cannot
the pain.
And
they did not compare this hot pack to the modality.
Can use this
Unfortunately,
evidence
other
to back up
studies
the
using the moist hot
pain.
did compare it to the
further
use of
research
either
should
modalities
or
examine how it affects
range of
motion
motion
and occupational performance.
kind of achieve the same
because
thing.
Unfortunately,
the
study was
do
one
a
of the
functional
first ones
outcome
to test
measure,
the
and that means
that we don't know if these patients just went home for 24 hours and sat there not using
Unfortunately,
the
there is a lot of
or
limitations.
were they running
the study
outside,
failed to report a variety of
information
such as
inclusion
we don't
or
know what their
exclusion
functional
location of the
what their
study,
functional levels
duration
were
of the
at the
study,
time.
recruitment of subjects,
So we just don't know
or information about the subject's medical
how
history.
this modality
like
would
we touched on
affect
before.
all those other things.
Any of these things can skew the results.
Article
they
also
did not
go
mention
into saying
how they
that
even
even
though
patients,
if they
saw
results from 1 to 6
clinic
hours,
or
depending on the joint
they didn't
being
say where
used,
the clinic
that
was, they didn't say the
might
time
change.
frame that they did
So
this.
maybe
If
the
the
shoulder,
it
only lasts for 3
hours,
and it's all
or
based on the client issues,
anything
and
like
the
that,
client,
and that can all affect
the
medical
results
history as well.
They did have
That's
a small
all
sample
the
size,
information I have for you today.
Here's
There
the
was no
citation,
control group to compare
and
to.
I hope you enjoyed this presentation.
And there was
Thank
no
you so much for
functional
listening.
outcome.
So for OT, that's really important because yes, they tested the pain levels and they saw that the pain did decrease afterwards, but how does that affect functional performance? Does that increase functional performance after the use of the modality? Can we use this as a preparatory method before practicing different occupational interventions? And the last thing that was an issue was that they had an uneven number of subjects for each body region. So the majority of these subjects had low back pain, which there are different sensory neurons, just a different number of sensory neurons in that area compared to maybe the knee or the shoulder. And also low back pain, it tends to be more of like a chronic injury where someone could have had more knee injuries. It's just a different type of injury and it could react differently to the use of hot modality. So like I said earlier, the clinical implications. Clinicians can use a moist hot pack to the shoulder, lower back, or knee prior to occupation-based interventions to reduce pain within the geriatric population. By using this modality, we're able to reduce the pain levels and possibly increase the occupational performance. However, the study does not focus on that functional outcome, so we cannot use this evidence to back that up, but we can use this evidence to back up the use to reduce pain. And then further research should examine how it affects range of motion and occupational performance. Because unfortunately, the study didn't do a functional outcome measure, and that means that we don't know if these patients just went home for 24 hours and sat there not using the joint, or were they running outside, were they active, did they have to go back to work? We don't know what their functional levels were at the time. So we just don't know how this modality would affect all those other things. And the article also did go into saying that even though they saw results from 1 to 6 hours, depending on the joint being used, that range might change. So maybe with the shoulder, it only lasts for 3 hours, and it's all based on the client issues and the client medical history as well. That's all the information I have for you today. Here is the citation, and I hope you enjoy this presentation. Thank you so much for listening.